With Dr. Tom Frieden, who led the CDC for nearly 8 years, starting in 2009. Doctor, it took us a while to get us on your schedule. We appreciate the time tonight. You heard the president there. Do you think these new mandates and incentives will make a difference or work?
The bottom line is that vaccines are our best tool to get past this pandemic. Right now, we're seeing big increases in cases in the U.S. because the Delta variant is more than twice as infectious. That means that we're going to have to double down on protection, increase vaccination, and even for those vaccinated, where disease is spreading rapidly in indoor spaces, wear a mask.
So how do we get there, Doctor? If you were in charge of the CDC still and you had a chance to hold a news conference today and let's say maybe just hit the reset button, what would you say?
Well, first on vaccines, we have to listen. There are a lot of people who still are asking questions. We have to address those questions. There are good answers to them all. That's why I and all of my family are vaccinated. But we want to make sure that people understand that there's no ulterior motive here. Our goal is to save your life and the lives of people around you. We're losing far too many people still, close to 300 deaths a day in the U.S. I think we've gotten hardened to that.
Is this all on the unvaccinated, Doctor, at this point?
You'll hear some talk about breakthrough infections. No vaccine is perfect. This vaccine isn't perfect, but it's a great vaccine. It's stunningly effective, and it drastically reduces the chance that you'll get very sick or die or spread the infection to someone else who could get very sick or die.
This is my point. If it is on the unvaccinated, and as insensitive as this sounds, and I don't want it to come off that way, but are we at a point where people have enough information now to know I either want the vaccine or I'm not going to get the vaccine? I'll either wear a mask or I won't wear a mask. And we'll let the chips fall where they may. And those who are taking the chance and rolling the dice will have to pay the consequences.
I don't think so, because first off, attitudes change. We're seeing a big increase in vaccination rates in states having a lot of cases. When you see your friends getting sick and dying, you may get much more interested in getting vaccinated. Second, we recognize that we're connected. So you not getting vaccinated or you not wearing a mask may result in you spreading this infection to an older person or someone with a kidney transplant who could die from it.
Yeah, well, that is the point, is getting that message out. And on that, I'm wondering, it's so divisive, Doctor. Do you ever think in your career that we'd get to this point on a medical issue that's involving a pandemic? I mean, what has this, in your opinion, what's it exposed about us?
You know, the fact is that many public health decisions are policy decisions. They're even political decisions. What's been so disappointing about COVID is that they've become partisan decisions. You know, the only parties here really that should be fighting are human beings against microbes. We should have no difference among us in terms of simple measures that save lives, that protect people, that get our kids back learning in school. We can do it if we work together.
Can vaccinated people get and transmit the virus? We know they can get it. Can they transmit it?
They can. We've seen that recently. It's more common with the Delta variant, but that doesn't mean vaccines aren't working. They're working phenomenally. They're already saving tens of thousands of lives, and the more people who are vaccinated, the more lives they'll save.
Well, we'll see what happens moving forward. Dr. Tom Frieden, again, it's great to get you on the program tonight. We really appreciate your time.
Thank you.